Hi, everyone. My name is Nick Nestle, and I'm a solution architect at Dimagi. And I've basically been involved over the last 2 or 3 months on these templates, starting with working with the CDC to develop these templates and then implementing them in a few counties in California. So what I'll show to you today is kind of a holistic overview of the system of the workflow that we've built into these templates. And I'll also try to point out the places that are configurable along the way. So I think this will give us a good starting point, and then I'll be able to point out where, these are the things where you'll probably want to tweak for your own counties and your own engagements. Just at a very high level, what I'll be covering is starting in case investigation and then showing how that flows into contact tracing. And then I'll show at the end some PUI workflows for tracking suspected cases as well. So that I'll start. So I'm going to be logging in as a few different users as we go, and I'll be pointing out as I log in back and forth. And so this is just an admin demo interface that I have that allows me to kind of switch users like that. But most folks will be logging in via a two-factor authentication of their own, and they won't have this privilege. But as the first example, I'm going to log in first as a case investigation supervisor. So this is the person that's in charge of the case investigation team. And the first thing, and what you'll see a lot as I'm logging in, is the first thing that I do is I check into the system. And the point of this check-in is not to do time tracking or anything like that. It's just to alert the other people that are working that I'm actually also online and working right now and eligible to have cases assigned to me and things like that. And so it's just a mechanism where we can see who's online and working as people, are rotating through different shifts and things like that. So I'm specifying the languages that I speak because that's important. If I'm going to be assigned cases to investigate, I should be matched up with the same language of the cases themselves. And information from my own user profile is pulled in that I'm a supervisor. And as I log in as different users, we'll see different roles here. This is all just to help make the assignment process easier. If we're assuming that most people are going to be working from home, we need those kind of communication things to let us know who's even online at a given time. So the screen that I see here is what I see when I log in as a case investigation supervisor. You'll notice most of the things here are all focused on cases. As I log in as different users, they'll have different views of the same data depending on what their role is. But in this example, what I first want to do is I'm just going to walk us through what happens when a new case is registered, and we'll kind of follow the workflow through of how a case travels through this and how we get it assigned to the right people. So first I'm going to choose to register a new patient. And this is probably one of the most important things that we would talk about right at the start of it, implementation, is how cases do get into your system. We're configured pretty flexibly. I know sometimes, lab results come in via fax, or they may come in, through phone calls, or, however you get a positive case, we would adjust this process for that. In some counties now, we actually have a direct integration with the lab reporting system, and so positive cases are just automatically imported as well. So what we're showing here is the instance where we're not even sure if this is a positive case yet. So we may want to do a quick screening just to see if this is a positive case or someone that should be tested. And in that case, we have an algorithm here to just assist the person who's talking on the phone to ask, is this person a healthcare worker? And then what are the various symptoms that they might be experiencing? And based on how I'm answering these questions about symptoms, it's giving me a recommendation of whether or not this person should be tested or not. So since as we prioritize different people for testing, the algorithms are changing almost daily of how we prioritize. And so building these algorithms into CommCare and allowing them to be changed on the fly is really helpful in that registration process, so that the people that are registering patients don't have to memorize that algorithm. It's kind of changing as they answer the questions here. In this case, though, I'm going to take the instance of if we know that this is a positive confirmed case. So I don't really need to do a screening. And what I'll do is just quickly register a person. So I'll register myself as the case. And when I submit this form, it's going to now take me to the full intake form for case investigation. So in the instance that I'm showing here, what I really am right now is just this intake person. So I may not have all of the information that's needed in this case, but I'll fill out the information that I know. One of the features that's super important is the note feature. So since a lot of different people will be interacting with this client at different times, we can add a new case note into the system. We'll say, spoke to Nick on the phone. So these notes will be, visible for anyone to see as they open this case. I'll notice right now this case is not assigned to anybody at the moment since we're just doing an initial intake. And then it's quite a long form. So what's important is the things at the top are important to fill out of what is the actual disposition of this case. So in this case, I've reached this person and they've agreed to talk to me. And then at the bottom, we'll have some actions that we want to choose. But the rest of this form is extremely configurable based on the information that you would collect in your jurisdiction. Hopefully it looks pretty familiar. So in this case, what I'm going to do is simulate Nick is an English speaker. We have his master ID. We can track whatever other IDs you may have in your systems if needed. And what's most important is we're going to need their phone number. But for right now, I'm going to not record this phone number. And this may just be all of the basic information that we have about this person on an initial intake. If you imagine maybe a lab result comes in, so all you have is this person's name and perhaps their date of birth is the only information that you'd have to go on initially. So that would be what gets loaded into the system initially. And while we do have a long form, I'm going to actually skip over everything else. I'll mark that this is not ready for clinical review and submit that form. So again, like you will probably have your cases coming in from a variety of different sources. And depending on where they come in, they would get populated. But once they're in the system, the first stop in the queue is this cases needing phone numbers. And so there's typically a team who's in charge of just making sure that any case in the system has a phone number so that, that case investigator can follow up. So we can see that I'm here in this list of cases needing phone numbers. And so someone who's in charge of getting that phone number would come in, and whatever mechanism they use to get that phone number is what they would use to populate it in. But you'll notice it's the same list that we had before. I can see the previous notes that were left by people, and I could add a new case note. So maybe what I did is I spoke to Nick's provider who gave me his contact info. Again, this is just for communication with others. And if I go down to the phone number, I would fill out his phone number as well. I'll walk through the rest of this form now, but again, typically in the workflow, there's one person who's just making sure they can get the contact. And so if that's all we need to do, that would be all we need to do. So now Nick has moved out of this cases needing phone numbers and has moved into the unassigned cases. So he's basically, this has been vetted. There's enough information for a case investigator to actually reach out and contact. So what's important at this stage is typically, there'll be a big staff of case investigators who are just making calls all day, and we need to make sure that they're getting assigned enough cases. And so as a supervisor, I have the ability to do a bulk assignment. And so the supervisor would come into this form and decide which of my contact and case investigators, should have cases assigned to them. So what this allows me to do is, through the day, your backlog of new cases may pile up, or your backlog of new contacts may pile up. And this allows a supervisor to distribute those cases out to their workforce so that their queues always stay fully full. So in this form, I could see there's 6 cases that need assignment. And it's giving me a breakdown of what those cases are. So 5 of them do have phone numbers already. 4 of them speak English, and 2 of them we don't know the languages, giving us some more information about who is symptomatic or not. But what this is allowing us to do is I might want to first assign all of my English cases who are symptomatic because those are my highest priority cases. And so I can see right now there's only 1 English speaking case that's symptomatic. If I relax the requirement on English, that's okay. If I could say any, so If I say either yes or no symptomatic, that will give me 5 cases. So I'm basically searching for the highest priority cases that I have deemed priority. Maybe I only want to assign ones with phone numbers. And then I choose who do I actually want to assign this to. So I probably only want to assign that to English speakers. And ideally, those English speakers would actually be online right now. But it looks like I don't have any English-speaking case investigators online. However, I could choose to show me the offline people so I could actually fill their queues up while they're offline. And so when they log in, they already have cases assigned to them and waiting for their action. So in this instance, I'll choose to assign those 5 cases, and I'll just spread them out between my 2 cases. So these are actually people's names, CI1 and CI2. This would show Sarah Sagan and Clayton Sims, right? It would actually be the person's name here. These are just what our demo names are. So as a supervisor, I'm basically assigning those 4 cases I've selected. They'll each get 2 of them when I submit this. And then I can also monitor the queues. So I want to know, how are my people doing? Are their queues full? Are they busy right now? And so I can see I actually have 3 case investigators that are currently online. Case investigator 3, myself, the supervisor, and a test user. And then those 2 people I just assigned to are not online, but I can see it's okay because when they do get online, they're going to have some cases waiting for them. There's a concept of reservation, which I'll touch on a little later. But basically, this is allowing a supervisor to monitor their workforce. So now I'm actually going to log in as that case investigator 1. So this was the person that we just assigned those 2 cases to. And again, I'm checking in to announce that, yes, I'm online and working. It may be that I also feel comfortable in Spanish, so I can update my profile to say that I'm also a Spanish speaker. And then for me, all I need to do as a case investigator is come to my cases, and I see the cases that have been assigned to me here. So I happen to not get that Nick Nestle case that was created assigned to me because I think I selected the wrong things. But this is another good example. If there's a case that I know that I want to edit, I don't have to just come to my cases. Everyone always does have access to all of the cases in the system through an all cases option. So I have my list to direct me where to go, but if I need to look someone up, I can look them up in the all cases. Perhaps this was a case that I worked on before and I know this is who I need to work with. Or maybe they called in and I needed to just look up their record quickly. So even though it's assigned to case investigator 2, if I'd like to, I can still edit this case because in a lot of cases, it's very unpredictable who's actually going to call in at any given time and what record you're going to need to work on. So in this case, or in this instance, I'll go back into the case investigation form. And now I'm actually conducting that interview with this person. I've called them. I would review the case notes of what people have said before. Okay, I can see that they spoke. And now I'll go through the form and I'll go a little bit slower through the form so we could see some of these options. But again, this will be your form to configure and fill out how you need to. Probably a lot of this will be the same, but you may have different questions that you need to ask or different algorithms that go depending on the answers. We'll fill out the name. If we want to record a GPS coordinates, we can do that here. I'll just put in a zip code for now. I'm in San Diego. But this would, if we want to use this to drive reporting, we can do that. And again, I'm not going to fill out every single question in this form, but I'll go slowly through. The lab results is pointing to our lab results module. So in the template, we're assuming the lab results are populated automatically through an integration. But if we want to manually enter lab results, these fields can become editable as well. Emergency contact info is tracked. And then we have outbreaks. So if we need to track that this person is part of an outbreak or an investigation, we can associate all of our cases and contacts with outbreaks as well. This one just has a text box to describe the outbreak. However, typically what you would do is configure a select list to predefine what outbreaks are happening currently that you're tracking, and then you would select from that. But just for the demo purposes, we're just typing in names for the demo. Now, based on how I answer some of these living situation questions and occupation questions, it's going to trigger different referrals and actions from other people in the system. So I'm just going to say that I live in a single family home with 3 people. And I'm going to say that I am able to isolate myself. However, I don't really have a private bathroom that I'm going to be able to use myself because I live in kind of a group setting with my family, but I do have enough food and I don't need additional help. But because I answered this isolation question in this way, we'll see some answers triggered down below. I'll answer that I have another job. I could say I work at a bowling alley, let's say. I'm not hospitalized. This person is at home and they're not deceased. We have a clinical review of what symptoms this person may be experiencing. For the time being, I'm going to say that this person is actually not expressing any symptoms. They don't have additional medical conditions, but we may want to say that they have actually been exposed to a person with COVID maybe 2 days ago. And maybe that person was his mother. And again, this is just asking further questions about the contact that I had. My activities section is an important section because this is actually going to drive some more referrals. So if I say that I went to work since I became positive, it's going to prompt me for what is the work name that I work at. So I said it was the San Diego bowling alley that I work at. And it's actually going to ask for the address because that's going to trigger a separate workplace team to actually go out and inform this bowling alley that someone is tested positive. And so I think in many jurisdictions, there will probably be very different teams of who go out and make notifications either to healthcare centers or senior living facilities or to workplaces or schools. And so I'll show you how that's handled in CommCare now. So now that I'm done entering the information, based on how I answered it, you can see I am being notified for the isolation and quarantine team is also being notified because I answered that I'm not able to have a private bathroom. So this is a team that's in charge of reaching out to this contact now to be sure that they get guidance on how to properly quarantine themselves. And if I specify that I worked at a healthcare setting instead, you can see there's also a separate hub for healthcare workers. So here, since I worked at a healthcare environment, there's a different team who's dedicated just to following up with healthcare workplaces. So right now that's pending and I'll show you what happens. Finally, I need to register this person's contacts. And so I can choose to do that now, which is what I'll do. I'll choose to take me to the register contacts form. So again, and then the final thing is, since I did complete this full interview, I'm going to change the status of this interview to complete. But in the workflow that we have configured, what happens is a clinical reviewer needs to come and perform a clinical review before this whole case is closed out completely. And so right now that's just pending. And so again, the things that I entered at the top around notes and assignments are very important. And these kind of status fields at the bottom are very important to drive our workflow. But everything else that's kind of in the middle of the form, we can edit or update, configure how it needs to be for your jurisdictions. So now that I checked that box to actually register new contacts, I'm able to come here and actually takes me straight into our contact registration form so we can record who the contacts are. What I'll choose is I'll choose to record 2 contacts. First would be Nick's brother, Chris. And I do know his phone number. However, since this is a contact, I may not actually have much more information about this person. So whatever information I have about this person, I would fill out and the language that they speak. However, if I go to, maybe that's all I know about this initial contact. And if I go to the second contact that I'm filling out, it may be someone that's even more nebulous. maybe this person, all I know is it's Bob and he's my coworker, and that's kind of really all they have to go on there. And so that would be good information for the workplace hub to know, where someone will need to track down a bit more information. But it allows you to just fill in as much information as you happen to know about that contact, and maybe Bob speaks Spanish instead. So now that interview's basically been successfully completed for this person. And I want to show you what has been triggered now. So if I log in now as a hub member, so as I mentioned, there were those referrals that were happening based on how I answered my workplace question. The way it's configured now is this is a view for hub team members who are more cross-functional teams who are in charge of basically following up in different areas. So the way that the template is configured is there's a separate hub team that follows up for schools. There's a separate referral team that follows up for workplaces or healthcares or single room occupancy. Likely this is something that you would want to configure. You may just have one team that does all follow-ups. You may have even further breakdowns here, but this pattern can be extended or deactivated if not needed. So if you remember, we had a referral to the healthcare hub. So we can see here is Nick, and he's pending because he has the healthcare hub needs to follow up with him. Again, that would take me straight back into the same form. So I can review all of the same information that's been filled out by others. If you remember at the bottom of the form, since I'm a member of the healthcare hub, I could mark off that he's now been contacted successfully. I made the contact today. And I informed the workplace he may follow up with proactive testing here or something. Whatever information is needed to track that. If they do decide to actually do contact tracing at that workplace, they could actually change the status here to contact tracing in progress. And then that would, alert the contact tracing teams to begin a deeper investigation. Okay, so the next thing I want to take you to is we just registered those contacts for this person. And so I'll log out as this user. I'm checking out of the system. And now I'm going to change personas to be a contact tracer. So this is I'm going to first log in as the contact tracing supervisor. So this persona is, a person that's in charge of the contact tracing team. And again, what they're going to need to make sure they're doing is managing their queues to make sure that their people are working. So they can always look at the contact assignments. They can see they've got a bunch of people that are actually online. I can see that they do have assignments to them already. So this is good. I know their queues are full. But if I want to, I can look in the unassigned cases and I can see, there's 3 that still need to be assigned. While I have that bulk assignment ability that we showed in the case investigation, I may also just choose, just by reading the information about this person, that I know who I want to assign this person to. And so I could just do an individual assignment as well. So I would choose the assignment form. And again, show me my English speakers. And I think I want to assign this to contact tracer 1. If I know for some reason that I want this person to always be assigned, I can choose to reserve this assignment for them so that when that person logs out, their assignment will still remain when they log in the next time. So why that's useful is because, with the shift work that's typically happening with contact tracing, you might assign 10 cases to someone. They only get to 8 of them before they log out. And so those 2 that when they log out, those 2 that they haven't gotten to, are going to automatically go back into the eligible for assignment pool. And that way they can be reassigned in the next shift. But if you do have some relationship with the person, maybe you call and you talk to them for a little while, and then you just don't quite finish the interview, you can mark that reservation button so that it stays assigned to you and you can follow up with them at the agreed time that you have with them. So the supervisor just did that assignment, and now I'm going to change personas to log in as that contact tracer 1, who we just assigned that case to, or that contact to, I'm sorry. Again, if I look into my contacts, I see what was just assigned to me here. And this is going to be a very similar process to what we had in the case investigation form, except we have a contact monitoring form. But the interface is extremely similar. I can see the information about that person, any notes that were left for me. I can see that this has been reserved for me. So this is a person that even if I log out, I will still have that assignment. So now as the contact tracer, I would record that I made that call and I reached them. Or what I might do is record that I left a voicemail because I was unable to reach them. So what this is set up to do is track the contact attempts. So I made a first voicemail attempt 2 days ago at a certain time, but I was unable to reach them. However, my second attempt, it may have been assigned to me or it may have been assigned to someone else. Maybe in the second attempt, they were reached, and you can specify that was today that I was reached. At this time, I reached them. So this is where we can have basically like a call log. And you may have, the way it's programmed now is that you would have up to 3 attempts to call. And after the third attempt, they would declare that the person is unable to reach. But that's a configurable setting. So you could see the third attempt. If I had chosen, now I have the option to say this person is unable to reach if I get to 3 attempts. So the rest of the contact tracing form is hopefully probably pretty familiar. It's asking a lot of similar questions as was asked in case investigation about address and phone number. This is an important question. Can the phone number receive SMS messages? Because we'll be doing some SMS surveys with them. And again, we can track all the additional information. So I'm gonna go through a little bit quickly here, answering some of these basic questions. Information about their providers if we need to track that. You can see since the case was part of an outbreak, the contact is also considered to be part of this outbreak, and that information was copied over from the case record. Now again, we would fill out more information about this person. This person lives in a home with 3 people. People say they are not living with a confirmed case with no occupation. Again. And for a moment, I'm going to say that this person is not symptomatic. We do have a workflow that gets triggered if they report symptoms, but I'll show you that in a second. And I'm just going to note that they haven't had any underlying conditions, although filling these information out, if you do have underlying conditions, it does actually trigger a high-risk workflow. So you can prioritize high-risk people if needed. Asking me about my exposures. Since this person is a contact, we kind of know that they have been exposed, so that's been defaulted to yes. And we're confirming with this person when that actual last exposure date was. Living in the same household. And so then we have guidance. So based on how that was answered, we're recommending that this person quarantines himself until May 13th, which is 14 days since the exposure that we marked. It's giving some guidance of what to tell them, and it's asking them when is the start date of your quarantine. So they may have already started quarantine before you talk to them, but I could say it started on the 29th, which means my quarantine will end on May 13th. I'll note that I do have food supply and I don't need additional help, but those referral teams would be notified had I not marked that. And then finally is our follow-up consent. And this is where I consent to receive our SMS surveys. So if I say yes, I would like to receive an SMS survey, it would be a daily survey to that phone number, the language that I choose. And we'll show you that survey in a second, but just for this demo, I'm going to type in the time that this survey should come, but normally in a non-demo scenario, it would be sent in the mornings typically. So this demo is on East Coast time. So you guys help me out here. It's 2:30 for me. So it is 5:30. So that would be, I'll give myself a little bit of time. I'll give myself 3 minutes. Is that right? Is that 3 minutes from you guys East Coast time?
Yep.
All right, thanks. So now based on how I answered that, since I did say I had underlying conditions, CommCare is automatically calculating that this is a high-risk person because we fall into one of these categories. I believe the one that was selected here was underlying medical conditions. And while it's suggesting that this person be classified as high risk, it is still deferring to the judgment of the person where they could override that if they want to. So in this case, I am going to confirm that it's high risk, but they may ask a clinician, you know, hey, this is what I'm seeing. Maybe we should calculate this person as low risk. A lot of times if the calculation is low risk, the clinician may hear something that they don't like and want to still classify them as high risk. And so in this case, I'll say my interview is complete and I'll submit this record. So a few things just happened when I submitted that record. A couple of workflows are being kicked off around SMS. And so I just want to share my, so that was my phone number. And I'm just connecting here to my phone. So this is my phone, and you can see I just received this SMS welcoming me to the system. Hello, Chris, this is your public health program. We're gonna send you a survey every 14 days. And so I can unsubscribe from this at any time, or if I want someone to reach out to me, I could type contact and someone would reach out. This information above is from previous demos that I've done. So in about a minute, my survey is going to start, but typically the survey would start the following day. So while we're waiting for the survey to start, we'll just come back and I want to show you the checkout process. So if I happen to be now done with my day, I can choose to check out, and you can see I still have 3 assigned contacts to me. And what it's alerting me is that when I actually check out and say that my day is complete, it's going to release these assignments. These are the contacts that have been assigned to me. And so since I'm not online anymore and I haven't started working with them, it's going to unassign these from me so they're eligible for the next person to be assigned. But also, since Chris was denoted as a reserved contact, it's actually going to keep this assigned to me so that the user can always specify if for some reason they want to be the person to follow up. They can do that as well. So I'll say, yes, I'm sure I want to check out. So now I'm signed out of the system. Okay, so we're back. I just got my SMS. So this is the daily SMS that comes. Hello, this is your daily wellness check-in. And this is just a very basic survey. It's just asking, are you experiencing any of these high priority symptoms of fever, cough, or shortness of breath? If I say yes, that's actually triggering workflows within CommCare. So we'd like to screen you further. A healthcare professional will contact you soon. So what's happened in the back end now, because I answered that I am experiencing symptoms, if I log back in as this contact tracing user, sorry, actually, I'm gonna just sync. If I log back in as this contact tracing user, and I go to my SMS FollowUp queue, I can see that Chris Nestle is now here because they reported symptoms via SMS on this date. And I can also see that this is a high-risk person. And so this is the queue that's important to have someone monitoring each day. It is possible to trigger emails or SMSs to workers when this happens. But we find once you hit a certain volume, you know, those emails to workers become a little overbearing and people just get used to logging in and using this queue as, you know, every day check this queue and make sure that anyone that's reporting symptoms is being followed up with. And so one of the things I might want to do if I open this case is I know that this person reported symptoms. So CommCare actually has an SMS chat window here where I can choose to find out more information about that. So let's see if I can these up on the same screen. So as the user, I would say, hi, Chris. Sometimes I did not send the SMS. So I'll send it. And so it pops up here on my phone. I've already started typing my reply. I have a fever, which then comes in the screen. So you would have whatever conversation you need. You may call them, but if you want to SMS, you can. And maybe I would say 103. And so that conversation would go however that conversation would go. Hopefully you would give them some better advice. But in CommCare, then once that interaction has completed, you can come in and actually report the results. And so first at the top of the screen, it's alerting me an SMS follow-up is needed. So I'm checking off that yes, I have actually followed up based on that SMS. That way that alert goes away and people don't think that he still needs to be followed up. I would probably record that I reached the contact and they agreed to a call. They agreed on this date at this time. And then since he reported symptoms, I'm going to come down to the symptoms area. And he reported that he had a fever and that fever was 103 degrees. And today was the day that that fever started. And so now that I've updated that this person has a fever, they're being classified now as a presumed positive case and they're being recommended for testing. So at this stage is where we can plug into the PUI workflow, and this contact is now going to be promoted up to a suspected case for PUI, whatever the terminology that you use. And when I submit that, we're actually creating a person under investigation in the PUI module for that PUI team to follow up with testing. The way it's configured right now, and I think this may be different for different jurisdictions, is that this contact that we're talking about does still remain an active contact in the contacts module because we're not sure that this person is positive yet, and we still want the follow-ups and the contact investigation to carry on for 14 days until that person becomes a confirmed positive case, at which point we stop tracking as a contact and would start tracking as a case. So I'm going to be checking out now as my contact investigator. And I'm going to log in now into the PUI module. So that contact that we had has now been upgraded to a PUI. And this is where I think the PUI workflow and that linkage between contacts and PUIs is, I think that probably is going to vary quite a bit between different jurisdictions. Just in the few counties we've talked to in California, even though they're very similar to each other, they have different workflows and different teams. And that kind of also depends on the volume that you have of how your team structure is set up. But our template app is really designed for the PUI process to register new PUIs and then also give them the ability to schedule testing. In addition to scheduling testing, it allows us to schedule transport if the person needs transport help. And it also has support for field testing. So a lot of the counties in California have a team of field nurses who are actually going out and proactively testing in areas, whether it's been an outbreak that's been identified, or they want to just pick a facility and go test everyone there, or one-off cases where a person just can't leave their house and needs someone to come to them to do a field test. So from a PUI point of view, you know, I guess we don't have any demo ones yet, but if we want to show our PUI of Chris Nestle is now here as someone that needs scheduling. So from the PUI workflow, again, it's very similar. There's assignment options, and there's a single PUI form that's going to hold all the information about this person. So I'm going to go a little quickly through this PUI form because you've already seen two very similar forms. But again, like you'd be configuring this how you need to configure it. I'm just going to scroll all the way down to the bottom because I think what's important here is management of appointments and testing from a PUI perspective. So for PUIs, what's configured here is the referral that needs to happen. So where should they be referred to for testing? In this case, we have configured for an alternative testing sites. And again, you would configure this to however you need it. This is an example from the Bay Area in California. So these are the testing sites that they have. Obviously, you would update to yours. And then this is the question of if they need transport or not. So if we specify that this person needs transport, that's going to kick off the scheduling workflow for transport. And at the moment, the lab and the transport scheduling is not done. Testing has not been completed yet either. We basically just registered this PUI. And then the final bits of the workflow is, since we said transport was needed, person Nestle shows up in the transport scheduling. The way that the template is assuming is that there is someone who's in charge of scheduling those transports. But again, similar workflow. We go back into the form, and since I'm the person in charge of scheduling transport, I would mark that transport has been scheduled. Maybe I actually do both appointments at the same time. At some point, so we'll submit that. At some point, they would get tested and update the lab results. And then the final piece for a PUI is after this person has been tested, when we finally do get a lab result in, again, we're coming back into the PUI form. And I think this process of how that lab result gets into the system seems to be like a big question that's always important to work out. But however you get a hold of your lab results, whether it's through an automatic integration, or if it's a fax or someone calls or you get an email with the results, at the end of the day, what we would want to be able to do is mark that the specimen has been collected, and we mark that the date that the specimen was collected. And we would also be able, sorry, I clicked to update the lab results here. So once the lab results are updated, this is now the trigger to take us all the way back full circle. This person becomes a confirmed case, and we're basically starting that workflow all over again from the confirmed case point of view. So when I convert this to positive, this person's now considered a confirmed case. And all of those case investigation workflows that we talked about are now kicking off as well. So that's kind of at a very high level, like the full life cycle of the system. And again, like I think what's important is we showed like 3 separate modules, and you can activate any one of those modules kind of on their own. So if you're only focused on contact tracing or only in case investigation, or if you're only doing PUIs, like those modules work as standalones, and then there's good solid linkages between them for when you activate them. That if that is ready in the template for when you're ready to activate it and use it.